Nikolas, thank you so much for your time. I'm really sorry for your loss, and I know this is such an awful time for you and your family, but can you take us through that communication breakdown at St Basil's?
Thank you, Annalise. Thank you for your kind words. Well, it's just the calamity of errors, to be honest with you. I mean, probably for myself, it started probably now 2 weeks ago when the first case of coronavirus was detected in the facility. I was told at the time that it was isolated in the dementia area, which is an area that's away from the low care and medium care area where my dad was. The people there were then tested. They were tested, and my dad at the time was tested as negative. Apparently there was a blunder with the testing regime, and the tests were redone a couple of days later. At that point, my dad's test was inconclusive. We were told there was going to be a third test, which I don't believe ever occurred. In the meantime, there were repeated phone calls that were unanswered. We were really, really struggling to get information. We were given a FaceTime number to ring to see our loved ones. No one, picked up the phone, picked up the call, the FaceTime call. In the one occasion that they did, they weren't able to put me through to Dad because they said they were too busy. On Wednesday of that week, the government-appointed personnel came through. A couple of days later, on a Friday, I got a phone call from one of their people, communication team, telling me that there will be a daily phone call to update us, update me with my dad's status and situation, which was a bit of comfort for me there because at least I knew I was going to be getting regular updates. So I was told at the time that my dad was isolated and far away and from the COVID area and safe in his room. If you forward to 24 hours later, which was a Saturday, around 3 o'clock, I get a call from the same person telling me that my dad's position hasn't changed. He's still in his room. He's fine. And right then, I was absolutely shocked to hear that, to be honest with you, because I'd had a phone call 7 hours earlier from the Northern Hospital from a doctor telling me that my dad is in hospital fighting for his life. So it was, I was at my wit's end at that time. I was really, really frustrated. I was struggling to be told this when you knew that that information was entirely incorrect. It was destroying, to be honest with you.
And your father was in this facility for 6 years prior to this, and you'd been pretty happy with his care before that?
Oh, look, it's been okay. It's been okay. There hasn't been anything that stands out as being problematic. There are things here and there. Maybe there was a hospital visit that he needed to go to that might have been missed, things like that over the last 6 years. He was okay. But in the last 5 or 6 months, it absolutely deteriorated. And in hindsight, maybe I should have made an attempt to get him out of there. It didn't happen. I hadn't seen him until he passed away, other than the FaceTime call I had the night before for 3 or 4 weeks. So, yeah, it's all hard to take, to be honest with you. And I guess from my point of view, it's just an absolute tragedy. I'm starting to call it the House of Horrors. It is. I can't describe my feeling right now. I'm just absolutely shattered. The only thing I'd like to say is the lady that I spoke to and gave me the incorrect advice, I don't have any ill feeling towards her. So if she's actually struggling with this, I'm not sure if she is because it's got a lot of media attention. I don't have any issue whatsoever with her.
No one takes any joy putting a spotlight on this, but it's so important because there's still so many people in this facility at the moment who could be going through exactly what you've gone through with your father. What was your father like the last time you saw him?
Well, 3 weeks ago, I won't talk about 3 weeks ago, I'll talk about the last time. We got a FaceTime call with Northern Hospital. The nurse there was brilliant in allowing us to have that call. He seemed okay, as okay as can be, being in such a serious situation. There was a smile on his face when he saw us, especially his grandkids. We were struggling. He didn't want the mask, the oxygen mask, because it was not giving him any comfort. But he was. We knew at that time he wouldn't last, and more than 24 hours. It was devastating. I mean, my dad shouldn't have died in 2020. He had many years ahead of him.
So what would you like to see happen now? I know this is just a really awful time for you and you're speaking out because you want to see change happen. What needs to change?
It's quite complicated from what I gather. There are a lot of people that are much smarter than I that hopefully will be involved, and there'll be a complete review, not only of St Basil's but the whole aged care system. But to me, the starting point would be to look at who runs these places. They're run by accountants.